Breast cancer, why reducing belly fat could be life-saving. Please leave us a comment below this video. Breast cancer is one of the most common types of cancer among women in the UK, and risk factors include alcohol and being overweight. Now scientists in China have found how women could reduce their risk of getting a rare and hard-to-treat type of breast cancer. Researchers found pear-shaped women are less likely to develop the disease than women who have an apple-shaped body. Obese women who have a buildup of fat around their stomachs are more likely to get ER-negative breast cancer, a form of the disease that cannot be tackled with hormone-blocking drugs. Those with who accumulated fat around their internal organs known as visceral and measured by belly fat, were predisposed to develop a different subtype of breast cancer than those that had accumulated fat more widely around their thighs, hips and buttocks known as subcutaneous. The study of women from northern and eastern China also found that being obese before the menopause raised breast cancer risk in these women. Obesity is a well-known risk factor for breast cancer, and often women at high risk of the disease are prescribed drugs like tamoxifen. However, long-term drug use has side effects, and tamoxifen only works for women whose breast cancer cells have receptors for the hormone estrogen on their surface, known as ER+. A cancer is estrogen receptor positive, ER+, if it has receptors for estrogen and therefore cancer cells that may receive signals from estrogen hormones that could encourage cancer growth. However, cancer cells that are estrogen receptor negative do not need the hormone to grow and usually do not stop getting bigger when treated with hormones that block estrogen from binding to cells. As a result, there are much higher mortality rates for ER cancer and it is much rarer, affecting between 1 and 4% of patients with the disease. The scientists suspected women's risk of developing ER+ or ER breast cancer varied with how fat was distributed throughout their body. They analyzed 1,316 women aged 25 to 70 newly diagnosed with breast cancer from 21 hospitals. They took body measurements and collected data on their reproductive and medical history, including whether they had been diagnosed with ER+ or ER breast cancer. Scientists found women with a high body mass index, BMI, and more fat around their thighs and hips, were more likely to have ER+ breast cancers, especially if they were premenopausal. In contrast, women with a high waist-hip ratio, WHR, and more fat around their bellies, were more likely to have ER breast cancer, especially if they had passed the menopause. This greater risk of developing ER breast cancer for women with a high WHR held even if they didn't have a high BMI. It was believed that obesity was more strongly related to ER+ than ER breast cancer, said Dr. Zhang Yu, a study author at the Second Hospital of Shandong University in China. I think there are two reasons for this. A possible reason is that subcutaneous fat is involved in estrogen production, which may promote ER+ breast cancer. Visceral fat is more closely related to insulin resistance and may be more likely to promote ER breast cancer. The study was published in The Oncologist.
Thank you for every like, share and comment, and don't forget to click the subscribe button to our channel.